Before proceeding with any examination, interview the patient and gain consent from the patient. Good evening, sir.
Good evening.
May I know your name, please?
Krishnan.
Your age, sir?
23.
Today I'll be performing cranial examination on you. Is that okay with you?
Okay.
Thank you. Before starting examination, perform proper hand hygiene. Let us begin our cranial nerve examination from the cranial nerve 1, which is olfactory nerve. For that, close one side of the nostril and ask the patient to breathe in. Please breathe in. And the same on the other side. There was no nasal obstruction. Now ask the patient to close his eyes and ask him to check the smell of the given substance. What can you smell, sir?
Coffee.
Thank you. For cranial nerve 2 examination, which is optic nerve, check the visual acuity of the patient by asking him to read and line. Please read, sir.
A satellite to escape from its orbit, the extra velocity to be recorded for it if the orbital velocity is v.
Thank you. Now let us check the visual field of the patient.
Yes. 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 Yes.
Now let us check for the cranial nerve 3, 4 and 6. Ask the patient to look at your finger and check for any diplopia. Let us examine for the cranial nerve 5, which is trigeminal nerve, which innervates the muscles of mastication. For that, ask the patient to clench his teeth. Clench your teeth, sir. Palpate. Open and close your mouth, sir. Move your jaw from side to side. Thank you. To assess for pain sensation, use a cotton swab. Ask the patient to close the eyes and detect for the dull and sharp end. Close your eyes, sir.
Dull. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Sharp.
To assess for light touch, use the wisp of a cotton. Ask the patient to close his eyes. Close his eyes, sir.
Yes. Yes.
Now check for the corneal reflex by touching the cornea of the patient's eye. Please open your eyes, sir. Note the patient is closing his eyelid and tearing. Let us examine cranial nerve 7, which is the facial nerve. Note for asymmetry, tics, or any involuntary movements of the muscles in the face. Ask the patient to bite his teeth. Bite your teeth, sir. Thank you. Now puff your cheeks. Puff your cheeks. Thank you. Close your eyes tightly. You should be unable to open his eyes. Thank you. Lift your eyebrows. Thank you. Now lift your jaw. Thank you. Let us check for cranial nerve 8. Perform whisper test.
3, 4, X, 8.
Now perform Weber's test to check for bone conduction. Is it same on both sides?
Yes.
Perform release test.
Stop.
You hear now?
Yes.
Thank you. Let us check for the patient's cranial nerve 9 and 10. Now ask the patient to open his mouth and tell ah. Note the movement of the soft palate, which is symmetrical, and the uvula should remain in the midline. Please tell ah, sir. Thank you. Let us assess for cranial nerve 9, which is the spinal accessory nerve, by asking the patient to shrug his shoulder. Shrug your shoulder, sir. And note the strength of the trapezius muscle. Thank you. Let us assess for the cranial nerve 12, which is the hypoglossal nerve, by asking the patient to open his mouth. Note for the tongue's atrophy while the tongue is on the bed of the mouth. Now ask the patient to stick out his tongue. Note for any asymmetry. Ask the patient to move his tongue from side to side. Note for any asymmetrical movement. Thank you.